is a program that we began at Keck in the fall of 2011 with the idea of being that we wanted to increase the number of graduates who go into primary care careers when they're done. Primary care careers being family physicians, general internists, general pediatricians, and geriatric physicians. And so in a world that's very quaternary and research-based, the students really didn't feel like they had a place where they could be nurtured, where they could be mentored, and really these interests could be fostered. And so this program was birthed really to give those students a home, to give them a community, and give them the mentoring they needed to achieve that goal of becoming primary care physicians when they're done.
The best way that the primary care program really fosters a community is by plugging you in with a cohort of like-minded students interested in primary care, interested in filling the gaps in the primary care system, really kind of working with the hardest and most complicated patients in our communities, and to work with those other medical students and side by side, and to go through med school year by year with them is one of my favorite parts of med school.
And so I feel that having the primary care track, students get from the very beginning to see what it's like to be in an office and actually be a primary care doctor. You know, most primary care doctors are not in the hospital, which is where most of them are doing their ICM and their training for the first couple of years. So they get to see how that is and what it's like to work with a doctor who's doing that all the time.
I think that both of my preceptors through the primary care program in my first years of medical school have taught me so much about giving care to underserved populations and to populations who would not otherwise have access to care, and also how we can give care to these populations, you know, in a humble way, in a comprehensive way, in a way that looks to try to address all of the factors that are contributing to their health, and not just prescribing pills, but thinking about diet and thinking about exercise, and whatever else it may be, housing that contributes to health and healthcare.
There's been one main research project that I've worked on throughout medical school that's definitely been fostered and encouraged through the primary care program. The way the primary care program has helped me to accomplish that has basically been through a community of encouragement and support, helping to connect me with different mentors that have heard my ideas out, have kind of encouraged them along the way, have connected me with public health professionals and researchers that have been able to help me to design the project, as well as just a community that really places social justice and addressing health disparities as the center of the conversation, as making that a really valuable aspect of our medical education.
So I've joined the board for the Family Medicine Interest Group, which was something that I was linked to through the PCP. And so, I mean, it's something that it's one of the sort of many things that I'm interested in, but it's a really great way to meet other people who are interested in family medicine and primary care.
I think I'm thankful for this program because just out of the nature of being able to work at different sites and see multiple patients more than you would through the normal school process, you're able to actually grow into being an effective leader with a lot of things under your belt.
I've been to a few of the primary care lunch talks. Stuff that's always on my mind being in primary care is, how am I going to pay for all of this? And they have lunch talks where, you know, they kind of bring physicians who are in primary care who have dealt with this loan burden, and they tell us there are ways to get around this. And despite the big loan burden, there are programs and whatnot to really, you know, help us, you know, pay back this huge loan that is on a lot of our minds.
We're expecting a shortage of primary care physicians, and that's why this program is so important, because we're helping to increase the interest in primary care and to help students get that early access to what a career in primary care will be like.
So one of the awesome things we get to do through PCP is we get to go to the Wellness Center and we get to teach nutrition classes. And I've also gotten with a group of my fellow first years, and we're doing exercise classes for the community, and it's so much fun. The community really appreciates it. After the nutrition class, not only do we like give them nutrition information, cook a meal with them, eat with them, you know, after that we have an exercise class. It's a lot of fun and they really appreciate it. You know, we're dancing, we're having fun, and it's just a great way to give back to the community.
So IPGC, just you work with elderly patients. You actually get to go to their homes, which is really interesting. You learn a lot just by sort of seeing how they live. It just lets you see another aspect of someone's life. But I would say even more important than that, in IPGC, you're paired up with physician assistant students, dental students, pharmacy students, occupational therapy, physical therapy, and you work as a team.
The majority of our primary care preceptors have been doing this for a long time. So they really enjoy taking our students. They think that UC has very high caliber medical students. And so for them, it's almost a privilege to be able to serve as a preceptor in our program.
I knew that I wanted to do primary care coming in. I was probably about 75% sure, but I think a lot of my patients really kind of inspired me. But there's one in particular that I always think about, and it was a little girl that came in just for like a regular well child check. She was probably about 8 or 9, and in speaking with her and her mom, we were just talking about the kind of things that she eats on a regular basis because she was obese for her age. Me having that ability to speak with them about something that's not necessarily directly related to medicine, but it does impact your health, was really fun for me and really impactful. Having the opportunity to speak with mom and the child as well, I thought was like, oh, I can do this all the time, and just kind of like building that rapport and relationship is something that I wanted to continue to do. And I felt like that's really, primary care was the only way that I felt like I could have those kind of long lasting relationships. So that was kind of influential for me.
So the PCP program has been exactly what I've expected and more. It's really given me a wonderful community of like-minded friends and peers and mentors who are really able to work with me to do the things that we want to do out in the community, and also, just have a really strong community at school.